for reflection. But yeah, let's move on to our Q&A.
And as people might be thinking about potential questions, there's another thing that I would add. On this topic of health equity, I am a firm believer, and some of you may actually disagree with me. I am a firm believer that one of the most important steps to creating a more equitable and healthy society is to train more healthcare people that are of a diverse background. And I'm being very intentional about my words because I don't want this to end up in the news record or anything like that and misquoting. But that is why for many years I've been involved, and I think Adam, in introducing me, talked about the $1.7 million in scholarship money that I've helped raise. That has all been earmarked for underrepresented minority students. Not that I don't care about majority students, but we have about 2.3% of our physician population in the greater Cincinnati area is African American, in a city that's about 50-50 black and white, and other races too. But, you know, if you just, you know, high level ballpark, about 50-50. And the national average is about 4.3 in terms of physicians of color, African American or black. And for us to be, you know, almost half of that in the city of Cincinnati is a problem. And if you really, in my opinion, want to make a difference with solving health inequities, I think you have to at least be tuned in to those discrepancies and those disparities. It's not all the time just about these vulnerable populations that might be poor or might not have healthcare literacy like you want. There's been a long history across the world, but in particular in our country, of racism in healthcare that has led to mistrust, that has led to people being left out, that has led to people not even trusting their own physician a lot of times. Let me stop there before I get on a roll. Do we have any questions, Adam?
Yeah, Maria, feel free to unmute and ask.
Hi, Dr. Lewis. Thank you so much for joining us today. So you really emphasized the importance of partnership and collaboration in your experience with the Village Life Outreach Program and just in building a more equitable world. What would you say, or what are the steps that your team took specifically in building trust with the communities and the patients that you wanted to serve?
Great question. And it is at the heart of what we do as an organization. And I usually bring it up when I'm talking about it, but I'm so glad that you asked. The main thing we did was keep going back. When we first showed up and sat down with the community, there's two things. Number one, we sat down with them and didn't have any plans. I think they were a little caught off guard with our probing questions elicited to draw out from them their thoughts on, hey, how can we partner with these Westerners, with these Mzungus, as they call us, which in Swahili means white people, but it's essentially anybody non-African. Even I am Mzungu to them. They were impressed that the Mzungus didn't want to just give them a bunch of crap and leave, that we didn't have much crap to give them, in fact, that we were there to talk and to plan and to figure out, okay, what is your view of your problems in your community? And here's the resources that we have. How do you think we can work together to leverage those resources that we have and the resources that you have, and how can we do that together? And then we went back, and then we went back, and then we went back. And it took many, many years of relationship building, meetings, and small steps. One of our first projects was distributing mosquito nets. Our thought was, oh man, we know mosquito nets fight malaria. Malaria is the biggest health condition here in this part of sub-Saharan Africa. Let's, raise a whole bunch of money as a nonprofit organization, and let's give out some free mosquito nets to the community. The village leaders sat us down and were like, hey, that's a great idea, but the U.S. government has already tried that. They gave the nets out for free, and now you see all the nets that the U.S. government gave out being used by the fishermen to catch fish. They said, if you want this program, this mosquito net project to succeed, let's work together and build it from the ground up, and let's actually charge people a nominal fee. They can't afford $6 a net like they cost down at the market, but let's charge them 75 cents. And then let's create a pot of money that goes to, with the proceeds, that goes to buy nets for people who absolutely cannot make that investment of 75 cents for net for their family. And so by listening to the community, by not doing things our way, by recognizing the skills that they brought to the table and not just assuming, oh, these folks have the equivalent of a 6th grade education, we know more than they do. Yeah, right. Every day I learn something from them. And in a lot of ways, my education in terms of my book and classroom knowledge means nothing. I've learned more in 45 years of life from other people in a non-academic setting than I've ever learned from a book or a reading or a teacher in an academic setting. And I'll hold to that until my dying days. Although I work in administration at UC, so don't tell my boss I said that. Are there other questions?
Yeah, Jonathan, go ahead.
Dr. Lewis, thank you so much for your presentation. It's been really informative to hear from someone with your experience and perspective. My question does kind of build a little bit off of Maria's. I was wondering, you talked a lot about the attitude that people have when they go to places like Tanzania, sort of coming in with the mindset that they're the ones that are going to solve all the problems. So I'm curious to hear what you think are important skills for people to have when they do go into those situations. How should we be approaching helping people in those situations? And then also, as you've been doing this work for several years now, how has your own thinking changed and how has that affected your practice back in Cincinnati?
That's a great question, Jonathan. And if I don't hit on both angles and if I go off on a tangent, let me know, because your questions just elicited a whole lot of thoughts in my mind. In terms of approach, I think is what you were getting at first. You know, how do you go into these communities and really position yourself and your work in the best situation possible? In my mind, it's all about one word. Well, probably 2 words: deference and humility. If we had time, I'd probably poll some of you to see if you know what I mean by the word deference. But I actually had a student from UC define the word deference for me. This is a term that I learned in college from my fraternity brothers. Go figure. But I had the UC student encapsulated in such a way that now I use it as my running definition for the word deference. And to me, what it means is the joyful, willingness to submit to others when necessary to get things done and to build relationships. And so what does that look like in Tanzania? It looks like me, despite my education, resources, wealth, know-how, stature in American society, it means that when I'm going into their society, I take a position of deference, of humility, where I am the more junior person. I'm very in tune to understanding culture in Tanzania. And grown folks in Tanzania, they don't want to listen to somebody that doesn't have gray hair, that hasn't been through experiences in life, no matter how smart they are. So it means me going in with a almost, I don't want to say submissive posture, but a deferential posture, respecting everyone in the community, because I know that I'm an outsider and I know that they have a wealth of knowledge that is greater than my own when it comes to their own community. What does it look like in Cincinnati in my day-to-day when I'm seeing patients? It means that when I enter a patient exam room, number one, I knock on the door and I enter the room in a position of deference and respect to my patient. I greet them with the hello, and if it's not COVID times, with the handshake. I wash my hands before and after I see them. I approach the exam, the history and the gathering of information with the utmost respect of the person that is on the other side. I show them love and compassion and empathy and respect from the moment I walk in the door to the moment I leave the door, to the phone calls and the emails that we do, to address their health concerns. Again, I can't emphasize more to your question, Jonathan. Deference. And where am I at on my journey and what's next for me? I think it's more of that. It's more of leveraging my resources and my influence and my impact to bring more people up the ladder of success, of wealth. One of Village Life's most notable things that we're doing right now is we're partnering with a university in Tanzania, where we are sending UC experts to work alongside Tanzanian experts. Yes, both in the city where the university is, but they are co-locating in our clinic in the rural area of Tanzania, and we are working side by side and learning from them and creating scholarship opportunities for Tanzanian students to go to college there, to go to college here. We have 2 students right now on a full ride. They're freshmen and they haven't come to campus yet because of COVID, but hopefully spring term they'll be here, or maybe summer or fall. But 2 students with a full ride through UC International's Global Scholars Program. And to me, that's the next iteration, the evolution of Village Life is not just us going to Tanzania and doing the work, but us continuing to train more and more Tanzanian folks to do the work. I'll know that Village Life's work is done. I don't want Village Life to be around forever. I'm kind of like, okay, we're 16 years in. When we started this, the goal was, hey, within 25, 30 years, we want the villagers to be like, okay, Village Life, thanks, but we got this now. Y'all go back home. And we're working closer and closer to that. And to me, that's the future.
Thank you so much, Dr. Lewis. Your expertise, your story, it changed me. I want to thank you for joining us today, really shedding light on global health, your work with Village Life Outreach Project. But yeah, right now we do have a few minute break for the audience. We'll put a discussion prompt in the chat, and yeah, we'll be getting ready for our next speaker.
Well, Adam and Elizabeth and all of you, thank you so much for having me. And anytime you all want to learn more or have more questions, feel free to shoot me an email or give me a call. I'm always happy to talk to this group, and I wish you all much love, much success, and enjoy this beautiful weekend.
Thank you, Dr. Lewis.
Bye-bye.
Okay, guys. So